Thank you, Mr. Chairman, and Mr. Secretary, welcome back.
Mr. Chairman,
it's good to see you.
Good to see you.
Listen, President Biden's budget is an incredible vision for supporting seniors in this country, and his State of the Union message, I think as Americans were listening in, were both bolstered by what he had to say about Social Security and expanding it, an issue I know that you care as deeply about as I do. But his budget also builds on the success that Democrats on this committee have had in lowering prescription drug prices. And this is a big deal, not only for seniors in my district, but across the nation.
Everywhere.
And the amazing step that was taken forward in terms of reducing drug costs has been incredible in terms of what it's meant to seniors. Now, as I indicated, and the President's budget calls on Congress to build on those successes by capping generic drugs for chronic conditions. How, having viewed this from the position, both having sat here and now being in the critical position as Secretary, how do you see that impacting and cutting costs for seniors?
Congressman, first, can I thank you for the dedication you've demonstrated on these issues for older Americans, and certainly your commitment to make sure we continue to improve Social Security. If you think about it this way, when you go to any American and say, what if I could tell you that you're not going to pay more than $2 out of pocket for a prescription medication, they'd say, get out of here. But now that we have said to them, what if I tell you you're only going to pay $35 for that insulin you used to pay $200 for, they're saying, hey, you know what? That's true, because now I'm getting it for $35. Now we're getting their attention. Now I think they're willing to say, well, maybe you really got something there. And I think the American public is beginning to see that we may finally get a grip on these drug prices and not let the pharmaceutical companies just dictate to Americans what we'll pay, because typically it means we're paying 2 or 3 times more than everyone around the world is.
What would you recommend that Congress do to build on our previous successes? And as you point out, to be able to say someone that $2 is the most you're going to be paying?
Well, the President put this prescription on your lap in his budget when he said, rather than only allow us to negotiate to bring down the prices of 10 of the most costly drugs for Medicare recipients, let us do 30, 40, 50 of those drugs. Why not save on all of them? And then he also said, hey, why don't we also make sure that if the drug companies are overcharging us beyond the rate of inflation, that we get to pull some of that money back for Medicare. And then finally what he said is, hey, $35 a month insulin, pretty good. For 65 million people on Medicare, that is very good. But how about the rest of the 330 million Americans? Extend the $35 cap for insulin to every American in this country. That's in his budget.
Well, that's extraordinary. Any idea, you went through the numbers there, et cetera, when we're talking about seniors specifically, you know, the 70 million Social Security recipients, what kind of costs are we talking about? And what kind of savings is that going to mean? You talk about kitchen table issues and discussions. Imagine the discussion at a table anywhere in America about what that would mean to individuals in terms of prescription costs.
I had a woman who was from Dallas who told me the story that in January, when the price of insulin had gone down out to $35, she didn't realize it. December, she had paid, I think she said she paid $117. She's on fixed income, relies on her Social Security check. She went into the pharmacist, purchased her insulin, walked out, looked at the receipt. She said, I felt so guilty, so I went back and I told the pharmacist, you undercharged me, I owe you some money. And he said, no, that's the new price, $35. She said, I was over the moon. I was over the moon because she did not expect to be saving so much money. For a person on fixed income relying on Social Security, that's a big deal.
Thank you, Mr. Secretary.
Thank you.
Yield back.
Thank you, Mr. Schweikert.